Hi there. Welcome to Sembang Sihat with me, Dr. Deeban, a one-stop podcast in all things regarding men's health and general health. Okay, so this podcast is again brought to you by Hemedical Clinic, your one-stop center for all things related to men's health. All right. So the topic today is a bit on the controversial side, something that a lot of them know, a lot of them think of it as being taboo, but it's important to know about it. It's nothing but sexually transmitted infections or sexually transmitted diseases. All right. So on this podcast, I have two panelists to join me. One is a female health practitioner and also a close, longtime friend of mine, Dr. Vaishni. Welcome to the podcast. And yeah, you have
Hello,
anything to
Deeban.
say? Welcome. Welcome to the podcast. I hope we can have a very open discussion, and it'll be interesting to see that you can bring in a female perspective to sexually transmitted infections. All right.
Definitely. Thank you for inviting me over here.
Welcome. And another guest is Dr. Prahaladan, my colleague, also my junior in medical school. So welcome to the podcast.
Thank you, Dr. Deeban. How are you?
I'm good. I'm good. All right. So to those who don't know, Dr. Praha is also my colleague in Hemedical Clinic, and I believe that we see sexually transmitted infections quite frequently in our clinic, in our practice. All right. So let's not waste time. Let me get straight into the topic. Okay. So sexually transmitted infections. All right. So my question is to Praha first. All right. If a person walks in and asks you about sexually transmitted infections, what are the first few things that they should know or that you would like them to know?
Usually, I would brief the patients what are the potential causes of sexually transmitted infection, because I think the stigma is that when we talk about STD, automatically people only think about HIV, but they're not aware of actually under the virus category there's HIV, there is herpes, hepatitis B and C, human papilloma virus, and also there are other causes to STD like bacterial infections, fungus, parasite. So I'll make them aware of what kind of infections that we need to get them screened off and just brief them on it. And of course, then we will assess the patient in history and examine and take investigation.
All right. So basically, to summarize, HIV is not the only sexually transmitted
Yes, exactly.
infection lah. So
Yes.
you have multiple other infections like gonorrhea, chlamydia, which are bacterial in nature.
Correct.
By definition, I think just to add on to what you said, I think by definition, sexually transmitted infection or as sexually transmitted disease, yeah, basically infections that you can get through sexual intercourse
Yes.
or sexual contact lah.
Yes.
So it could be viral, it could be fungal, parasitic, and as well as bacterial lah in nature.
Precisely.
All right, fine. So HIV is not the only
It's not the only STD.
Yes, correct. Okay, so my question to Dr. Vaishni. So as men's health practitioners, of course, we encounter a lot of sexually transmitted diseases amongst the male population, the male group of patients. What about female patients? Do you encounter sexually transmitted infections that often?
Definitely. It's almost equivalent to male, but female is in the category of a silent group, which
Okay.
means they don't come out. Okay, this is something like, okay, whether this is a symptom for STD or a normal symptom like vaginal discharge exam.
Okay.
So they will be like confused state. But when we come to a practitioner, then we notify them, okay, this is a STD sign. So then they will do a further investigation on that part.
Okay, fine. So my question to again both of y'all is how much is there a stigma amongst the general population or like the patients who come in regarding to sexual transmitted infections? Because I can understand, and this is what both of us
Yes.
encounter on a daily basis, is when someone walks in with symptoms like for example penile discharge or redness, pain, or in your case like vaginal discharge and so on. It takes a lot for them to open up at times and to describe how long they've had it, what are the potential reasons why they could have developed such a symptom. How bad is this stigma, and is it right for them to be to feel stigmatized?
I think firstly, even like most of the STD cases often asymptomatic. So those who develop symptoms, they tend to always think that it's HIV, only HIV, and that's the end of the world. There's no cure out of it.
Okay.
But commonly, actually, it's not necessarily HIV per se. That's why there are things like bacterial, fungus, or parasite that's complete cure is there. But even if it's virus, it is super suppressible that patients become normal and they live a normal life. You know, people die because of diabetes and hypertension rather than
Yeah.
HIV itself. So
True. That's what
I think the
we
stigma
tell,
is
yeah.
once you get an STD, that's it. You are done.
Okay.
So I would
Alright.
say it's not that. You know, there's a lot of things to look forward for. And in current medical advancement, you and I know, we all know that there's so many things that we can do and keep the viruses or the bacteria put to sleep and kill them off.
All right. So, Bashni, anything you want to add to that?
Yes, I felt that another important thing is they feel immorality, which means like they thought, okay, STD is something that promiscuity, or they feel like, okay, this is like a shameful for their family if they brought up these issues to the doctors or anybody else. So they themselves, they felt that, okay, STD, this is not might be a STD, probably as something like different and normal symptoms per se. So I think this is a stigma, okay, most of it. And second stigma that I noticed is they thought this is untreatable. Untreatable, and they thought, okay, this is like something like permanent. Example like HIV. I think when we talk about HIV, it's like a lot of people, they thought HIV is something like permanent and they will just end up with AIDS and die. So a lot of people, they didn't know that HIV can be treated, but only the viral load is just at the moment of, okay, not detected. Right. So yeah, that's for my view.
Another thing to add on, Deeban, like, I think fear of being judged is it's very commonly we face, you know, when they have a symptoms, they delay from stepping into the clinic and getting treated because they are scared being judged by the staff, by the doctors, and then that's another stigma.
So much to say that they go into the state of denial,
Yes.
initially denial that they could have developed a sexually transmitted infection, that delays in treatment, potentially even worsening the situation.
Exactly.
All right, fine. So I have some, okay, so this is my, I would say, experience when it comes to sexually transmitted infections. Likewise, what you all said is that a patient would think that sexually transmitted infection is only HIV, all right? And what I see generally is when someone develops a sexually transmitted infection, okay, besides the stigma, is that they develop a sense of fear, innate fear, unreasonable fear, and
Anxious.
everything, anxiety, and everything relates to HIV in their life. So every small bump, every small rash, that it's not necessarily infection even, okay, but they would blame it on HIV, and that robs the patient of
Paranoid.
makes them paranoid.
Yes.
Exactly. All right. But how prevalent do you think HIV is? Okay, let's take HIV for example. All right, as one of these sexually transmitted infections. How prevalent do you think HIV is in Malaysia today?
I think globally, Deeban, like HIV it's not as prevalent as other forms of STD. For example, based on WHO, they have recorded that yearly there's about averaging of 300 million cases of bacterial STDs.
Okay.
Which is the most, like chlamydia, gonorrhea, syphilis, even trichomoniasis. And every day they're recording about 1 million of STD cases globally, which is again bacterial, like instead of viral. So I would say because of these statistics, which patients don't know, they always relate that whatever they're facing is due to HIV. It's not that common, I would say, in Malaysia.
Okay, so I remember reading this news report a couple of years ago that in 2000, if I'm not wrong, again, I could be mistaken, but in 2022, there were about 913 cases amongst teenagers that were tested positive for bacterial sexually transmitted infections like gonorrhea and chlamydia. And out of that included children as young as 13 years. Okay, so that means to say that the younger age group is more prone to get sexually transmitted infections. But like what you said, the HIV prevalence in Malaysia is also coming down. So currently, I have some statistics with me. So this is just for general knowledge, and so that people can understand that not all sexually transmitted infections are HIV, and
end of the world.
Yeah, and it's not the end of the world.
Yes.
All right. So basically, is as of 2021, this is again from the Malaysia AIDS progress report. There have been estimated 81,942 people living with HIV in Malaysia at the moment. Okay, and out of them, about 50%, that's about 44,916 are on medication for HIV. All right. Now, of course, Malaysia's target for HIV control in 2021 was what we call as 95, 95, 95. Okay, so that means that 95% of people who have HIV know that they have HIV. Out of that 95%, 95% of them should be on antiretroviral drugs. And out of that 95%, 95% of them should be virally suppressed, meaning to say that when we test them for HIV, it should come back as undetectable. Now, sadly, so in 2021, we were not able to achieve that target. So the target was what we had achieved was 83% of people who have HIV know that they have HIV. Out of that, only 66% are on viral suppression therapy, and 80 out of those who are on viral antiviral therapy, about 82% of them have achieved viral suppression. Okay, so this brings us to note that there is emphasis on detection as well as treatment, and also safe sex practices and things that they can do. All right. So, Vaishni, can you explain why is there a need for testing, and when is the best time to test for any STD, not just HIV, but in general?
Okay, all right. So I would prefer depending on how bad the situation is or the symptom or sign is. So I would recommend at least more than 10 days and above.
Okay.
If the symptoms started, right? So it's very general for starting from the HIV itself. So we need to make sure that patient had more than 10 days to test for the simple rapid test.
Okay.
So for that instance, we can do for the other STD testing, but there is some certain STDs, like example, virus. So virus, most of them herpes simplex virus, it takes some time actually. Sometimes it can take 60 to 90 days for them to detect with a viral load. But yet you can still do an IgM test, which is earlier or acute infection blood test. So to determine whether you have it or not. But most of it, I think STD, when it comes to symptoms, the doctor definitely can recognize, okay, it would be the STD or not.
Okay.
Before the infection, before the treatment was started.
Before the treatment
Yes,
started. All right.
correct.
Okay. Okay. So coming to HIV, of course, there's a lot of discrepancy. Patients might not realize how soon they can test for HIV, for example. Okay. So usually for screening tests, especially fourth generation screening tests, we can do it at about 14 days from exposure. Of course, if you're doing RNA test or PCR test, that is earlier, about 10 days or
10
so.
days,
So
yeah.
I hope that gives clarity to people, that to the population, that you can't just test for STDs the moment you've been exposed. All right. But having said that, so when there is a delay in testing, right? So what are the things that Praha, do you think that they can do to prevent themselves or to reduce the risk of getting sexually transmitted infections?
So I think first of all, Deeban, safe sexual practices.
Okay,
Like-
can you elaborate what do you mean by safe sexual
So
practices?
wearing a condom,
Okay.
and then limiting sexual partners and potential exposures.
Mhm.
And then thirdly, there are things that the patient can take, like vaccines, to protect them against acquiring the infection. For example, like for hepatitis B and C, there is vaccines that they can get it before acquiring the infection.
Okay, you mean for hepatitis B, right?
Yes.
Okay, all right.
And then subsequently for HPV, human
Mhm.
papillomavirus, even the guys can get Gardasil 9 from acquiring the HPV infection.
Vaccination for hepatitis. For HPV
Yes.
infection. Okay.
And like viruses for like HIV, there's potential exposure within 72 hours. They can take post-exposure prophylaxis tablets or even pre-exposure prophylaxis tablets.
Okay.
And subsequently, what they can do is some practicing safe sex, like make sure like you pee before sex, and then if after sexual intercourse you pee again, and then wash your genitals properly, and also getting screened, of course. So I think these are the preventive measures that people can do out there.
Okay.
Can I add on?
Yeah, sure, Vishni.
Yeah, so I felt there's another two more, which is like abstinence. Let's say
Easier said than done.
Yes, exactly. So that's the best prevention.
Yeah.
And also probably 100% the condom is not prevented for the STD, and you should know that avoidance of having multiple sexual partners.
Yeah.
And be protected with one person. Okay, that's the best way for a
Yes.
prevention. I would say.
Okay. All right. Fine. I think okay. So that is pretty much again about sexually transmitted infections. That then be pressed on the need for safe sex practices, as well as timely and regular testing, especially
Yes.
if one has multiple partners and
Because
is at
STDs
risk.
often asymptomatic, so people might not do
Yes.
the test on time. They just say I'm healthy.
Exactly.
Correct.
That brings to the point that even bacterial infections can be asymptomatic. Usually, we associate symptoms with bacterial infections like penile discharge or vaginal discharge, redness, pain. Usually, is bacterial, and I mean this constitutes symptoms.
Yeah.
But I think time and again we've encountered numerous patients who test positive for bacterial infections yet have active bacterial infections yet have no symptoms. So they potentially are able to transmit infection to a much wider group of people unless they actually screen themselves.
Exactly.
All right, fine. So the next segment, usually we like to start off with a rapid fire question.
Okay.
So again, this rapid fire questions, it's on my phone. All right. So I'm
Okay.
just going to ask you guys a couple of true or false questions. All right. Feel free to answer true or false, and if you have anything to add on to that, okay, you can add on as well. All right. So it's not necessarily a rapid fire question, but it just true or false and hidden with your explanations if it's detailed. Okay. All right. So question number one: you can always tell if someone has a STI or an STD just by looking at them.
False.
Okay. Why?
I mean, like, even though it's asymptomatic for some, all right, so we can't judge them, right? So that is the important thing that for a professional.
All right. So it goes to say that you can actually have STIs and yet have no symptoms. So
Yes,
you really
correct.
can't tell by
Can be
looking
just
at them.
walking
Yes.
around with anybody else.
All right. All right. Second question. Using a condom during sexual intercourse offers 100% protection against all STDs or STIs.
False.
All right.
It's
So,
about 98%, I would say.
98%. Okay.
Yes.
And of course, the risk is higher if there's a breakage,
Break or slip.
You
slip
still
off and all
can
that.
Yeah.
transmit through skin to skin contact.
True. Not for all STIs though,
Yes,
right? Yes.
no,
So
Like
I think a lot of
HPV,
people,
yes.
HPV transmits through skin to
Correct.
skin
Skin to
contact.
skin
Herpes can be
contacts.
transmitted to skin contact.
Yes.
HIV, no.
Yep.
Yep.
Right. Fine. Okay. True or false? Sexually transmitted diseases always present with noticeable symptoms.
False.
Okay, false. Because I think this goes with
Yes.
question number one. Like,
Sometimes
it
it can be
asymptomatic.
very non-specific, like
Yeah.
just body aches and joint pains.
True. Especially if it's viral in nature.
Viral in nature.
All right.
Yeah.
Okay. So, fourth question: sexually transmitted diseases can only be transmitted through penetrative sexual intercourse.
False.
All right. Why?
Because oral sex also can transmit certain STDs like herpes type 1, even syphilis,
Mhm.
if they have active ulcers going on.
Mhm.
So I wouldn't say.
So there's a report that there's also data that suggests HIV can be transmitted through unprotected oral sex
yes.
as well. All right, fine. Then, okay, last question. Once you've had a sexually transmitted disease and it has been treated, you can't get it again.
False.
All right. Why?
It's always reinfection that people are not aware.
Okay.
So majority of them, they think that, for example, they have gotten syphilis and got it treated out of syphilis with injections. They think that they're gonna have immunity for lifelong. But little they knew that if you're exposed to syphilis or some other STDs again, there will be reinfection and again they will develop those kind of symptoms. So reinfection is something that everyone should be aware.
Okay. And what about reactivation? Can any infections be reactivated per se?
I think probably syphilis, it can be reactivated if or in within the period of treatment actually. So if they have a partner who hasn't treated, so they can get a reinfection.
Okay.
That's the main.
So there's a reactivation when it comes to syphilis. I've also seen cases where gonorrhea gets reactivated, and now this is mainly due to improper treatment or partially incomplete treatment. So I've seen cases of chlamydia, gonorrhea being reactivated years later. So it's always important for patients to understand that there's always a need to retest after you have done after you've completed a specific treatment protocol. So just to ensure that the infection has been eradicated. All right. So now when we mention about sexually transmitted infections and safe sex practices, like what Praha elaborated just now, of course, using a condom and all that, it's more on the male side, as in like there's a lot of pressure on the male to practice safe sex practices, like using a condom, peeing after sex, and so on. What can a woman do in order to protect herself against sexual transmitted infections?
Okay, for women, sadly we don't have, our condom or a female condom is not really protective because it can slip through, or it can just like slip off, or it can stuck into it. So the fluid still can go into the vagina orifice actually. So I would say most of the time, abstinence or avoiding having any sexual with the multiple partners, that were the best thing. Another thing is like how Praha or told. So peeing before and after is important.
Even for women.
Definitely,
Okay.
yes. So because the vulva area is important to keep the pH level better. So even for women, the same goes to it. And yeah, I think that's the thing.
Okay.
Because skin to skin, you can't really protect.
Prevent, yeah.
Yes, prevent.
Okay. So we also mentioned that there are also sexually transmitted infections that can be acquired through oral intercourse as well.
Yes.
So I think it goes to say that for males, it's if they are on the receiving end of oral intercourse, there's always put down a condom lah. But for women, let's say women are on the receiving end of oral intercourse, is there any way that they can protect themselves besides just abstaining and peeing after intercourse? Is there any other way they can protect themselves?
I'm not really sure about the latest
Okay.
newses or
Okay.
what, but it's something that we can't predict on that part actually.
Okay.
But most of the infection, like general infection, like gonorrhea or something like that, it's very risky for a man to get it because chlamydia, it can occur you can get through the oral chlamydia. So yeah.
All right. So, but this is again reports that I've seen that where for females, this is news, or this could be helpful for viewers, especially women, that when they are on the receiving end of oral intercourse, so they can again use something called dental dams. So dental dams is nothing but latex sheets that can be placed over the vagina when oral sex is performed on top of the latex sheets lah. So easiest thing, you don't have to go and buy a dental dam per se for this. Usually they would advise that just cut a condom lengthwise, so you get a stretch of a sheet of latex,
Okay.
all right, and you place it over the vulva, and then oral sex can be performed through that. That itself helps to reduce the chances of women getting sexually transmitted infections, especially orally transmitted sexual infections lah. All right. So I think pretty much we've come to the conclusion. So
Yes.
I think there's few things that we can take away from this discussion, especially is I would say that we have discussed about ways someone can get sexually transmitted infections, what puts them at risk of
Correct.
getting sexually transmitted infections, and of course the need for timely testing as
Testing
well
and
as
treatment.
proper treatment. Yeah. So anything else that you guys would like to add?
I think another issue that I personally face, Deeban, in clinics, patients are not open for treatment also. Those who are asymptomatic, because those STDs can be sitting in their body for years without causing any symptoms. It may be as simple as ureaplasma, mycoplasma, even chlamydia. So they are not open for treatment because they don't understand the complications that they can have if not being treated
Yeah.
for. So, which I think, yes, there are people who are willing to get treatment, but the acceptance towards treatment for STDs still is an issue, I would say.
So there are a lot of sexually transmitted infections are actually preventable as
Yes.
well as
Treatable as
curable, and only a very few of them like HIV and
Yeah.
herpes, which are I would say treatable. So the difference is that one is you get rid of the infection
Correct.
forever, and there are infections that you can suppress them so that they don't cause the potential health risk to the
That's
person lah. All right. So I think with that, I would say there needs to be a very open mind towards treating or towards discussing sexually transmitted infections. Okay, just a note that I would like to ask you, Vaishni, how important do you think sexual education is in regards to management of sexually transmitted infections?
I would say this is very important. Sexual education is important as soon as they are reaching mind state of the understanding about what is sexual. So I would say starting from 9 years old itself, it's important for them to know, because especially for females, a lot of them, they have like issues with the virginity and also a rape cases all there. And they know, the risk of STD is not aware during that time. So that's like very important, starting from the age of earliest.
At the earliest age.
Yes,
So
correct.
one should know. So I think there's a big misconception regarding sexual education as well. Sexual education is not just to educate a person or a child what is rape, what is good touch and bad touch. But it's also important to educate them on risks of getting sexually transmitted infections, so that you could see that they are able to practice safe sex and as well as save themselves from infections lah. All right,
That's
fine. So the take home message I think from today would be, if just feel free to add on, would be again the need to destigmatize sexually transmitted infections. So be more open in knowing that you can possibly get infections, but they are manageable, they are curable. Of course, they need to practice to be responsible and to practice safe sexual practices, and as well as when to seek help whenever there is an issue, and from the right person as well lah, not just anyone, but from people who actually know what they are treating lah. Okay, so is there anything else you guys would like to add on?
I think that's all, Deeban. I think it's
Yeah.
very complete, and people will be glad that they get this kind of information.
So-
you know?
Well, that's why we try to.
Because a lot of them are Google doctors out there. you know, they Google things
so
and they
don't
get-
Google everything. All right, so fine. I think that pretty much concludes today's episode on sexually transmitted infections. So definitely we'll be coming in with more interesting topics that we would like to discuss with, of course, our panel, and maybe stay tuned till our next topic. So till then, stay informed and stay healthy.